A new study out this week from the Journal of the American Medical Association, JAMA, tracks miscarriage care across this country, comparing states with and without abortion bans. It examined tens of thousands of cases between 2018 and 2024, and the findings were dire. It found that in states with abortion bans, women were less likely to be given the best standard of care medication because it can also be used in abortions. It also found that in states with abortion bans, some pregnant patients were forced to continue carrying their non-viable pregnancies while waiting for a miscarriage to occur on its own, which in some cases can bring greater medical risks, such as infections that might threaten the patient's fertility. And worse, as OBGYN and professor Dr. Maria Rodriguez told the 19th, quote, "This study likely underestimates the impact that abortion bans have had on miscarriage care because it doesn't consider people insured by Medicaid, which largely covers low-income people and insures about 1 in 5 Americans or those without coverage altogether," end quote. All of this underscores something we've long been saying here on this show, that abortion is health care. Full stop. Bans on abortion make pregnancy, which is already a more dangerous condition in America than it is in just about every other developed country in the world, yet more dangerous for everyone, whether or not they are seeking an abortion. We've heard harrowing stories like this with increasing frequency since the Supreme Court struck down Roe v. Wade nearly 4 years ago. One multi-year study published last month in the American Journal of Public Health found that states with abortion bans saw a possible 9.2% increase in pregnancy-associated deaths, either during or up to 1 year after pregnancy. Caitlin Cash was among 22 plaintiffs who sued the state of Texas over its abortion ban in 2023. Here's what she told me about her experience last year.
When I miscarried, I bled for 5 days at home. I finally went to the OB and, we did a sonogram, found out that my baby no longer had a heartbeat. She prescribed me medication. I left and I went to the pharmacy and they wouldn't fill it.
Wow.
They said they needed more information. So I went home. And what if I had gone to a Whataburger? You just can't win in these states. Being pregnant can be a death sentence. And now it can be, a path to being criminalized.
Caitlin Cash joins me herself. She's a reproductive rights activist, advocate, and a plaintiff in the Texas abortion ban lawsuit. I'm also here with Robin Marty, the executive director of the West Alabama Women's Center, the state's only full-spectrum, free and sliding-scale reproductive health center. She's the author of the new book, called The New Handbook for a Post-Roe America, the complete guide to abortion, legality, access, and practical support. Welcome to both of you, friends. Thank you for being with us. Caitlin, we just talked about your experience in that clip, but it's sort of important to remember in the argument that reproductive care is health care, that there are women who are affected by this regardless of what choice they wish to make. Pregnancy carries risks associated with it. And when you get into this world where everybody you confront, from a pharmacist to a nurse practitioner to a doctor, isn't sure exactly how this is going to go and needs to consult panels and lawyers, some women are just going to die.
You're right. Some women are dying. In Texas, there's such confusion, and that's what the laws are supposed to do. We live under 4 abortion bans in Texas, and it is incredibly complicated and confusing for medical professionals. And so therefore, when women are going through something like a miscarriage that is already devastating and already traumatic for them and their family, you then have to add this additional layer of confusion from providers who just don't know what to do, what the law is, and how to protect themselves. We have to remember the fines against these doctors, 99 years in jail. I understand they're wanting to get more information. It just is adding extra trauma to a horrific experience.
Robin, when Roe fell, the first trip I made, as you recall, was to you. I came to Alabama. I visited the clinic where you work, and you told us very clearly the degree to which your clinic's work is not simply about abortion. It's about all the information women need about reproductive health. In some cases, it's about getting birth control. And you warned about the collapse in medical care for all pregnant women, and even some women who are not pregnant or thinking of getting pregnant, but they just need advice and health care. You warned that this is exactly how it's going to go. And now the numbers bear out what you told me those years ago.
It's true. And what we are seeing is not just the collapse of the medical profession on top of what is going on with abortion bans, but because we are seeing hospitals close, because we are seeing more doctors who are refusing to come down to the South into these areas in order to take up jobs as OBGYNs or as emergency room doctors. This is the crisis. We are now in West Alabama. Tuscaloosa is the only place now where you have a labor and delivery place. And we know that our two hospitals, one of them is currently in an EMTALA lawsuit for refusing to see a miscarrying patient who eventually just gave past her labor in the bathroom after sitting in the emergency room for 6 hours with no care. This is the only place somebody can go for a labor and delivery between Tuscaloosa and the border of Mississippi, and they are just not seeing miscarrying patients.
And Caitlin, again, the two of you have actual real life experience with these things from different perspectives, but you've got actual real life experience. You have seen your life and your health threatened because of your state's abortion ban on multiple occasions. We talked about when you needed medication to manage your miscarriage, but you also had a health crisis after the birth of a healthy baby because of a complication of childbirth that the hospital was not prepared to handle as quickly as they should have because the actual equipment they needed to deal with your postpartum complication happens to be equipment that is also used in an abortion.
Yeah. I mean, after my daughter was born, I had what's called a retained placenta. And the treatment for that is to wait a little bit, see if they can get it out, and then to go to the OR and have a D&C. And because the D&C equipment is used to perform abortions, it was not prepared. It was not ready. It was either an administrative delay or a technical delay, but I waited an hour and 49 minutes and continued to bleed out until I eventually lost consciousness, went into hemorrhagic shock, and I spent my daughter's first night in this world away from her in the ICU while a nurse held her and ultimately needed a blood transfusion. And a retained placenta is not uncommon. It's a little rare, but they know what to do. It happens. It's a very common thing. And again, in childbirth, the number one cause of death is postpartum hemorrhage.
Yep.
And if we can't treat postpartum hemorrhage, which can be treated by the D&C equipment, but also by this medication, the medication that they are trying to ban, the medication, this is stuff that helps treat postpartum hemorrhage. And so, yes, women are dying.
Robin,
And if I can throw in
go
really
ahead. Yeah, go ahead,
quickly,
please.
It might also have been her doctor, because we know that the doctors are not fully trained on being able to perform this later procedure because they are not getting the training in their schools, because so many schools are not allowing their medical students to get abortion training. They may not be making it down here in order to be able to practice enough in order to do this. And this is all a cascading ripple effect of not having access to abortion throughout the country.
Right. So there are a lot of people, Robin, who come to your clinic and clinics like yours around the country, for whom it is their only healthcare interaction. These may be people who don't even have a regular general practitioner to go to. So there are, as Caitlin points out, there's far more complexity to abortion than most people get. Right? A lot of pregnancies go wrong. There are lots of complexities. A lot of them that go right still have complexities. And in a lot of the cases of the clients you serve, Robin, are people who are not keeping up to speed with every development in abortion law or in healthcare law. They come into you because they've got a thing that they have to deal with.
Exactly. And so for them, we are their only source of actual, reliable, non-stigmatized information. We know that there are places that are not telling people where they can go in order to terminate a pregnancy that is, in fact, non-viable. We know that there are doctors who are just leaving people to with ectopic pregnancies, telling them that they might resolve themselves on their own and they shouldn't be in the hospital. This is not how healthcare should work. This is not how human rights should work, because every pregnancy has the potential not just to potentially kill the person who is carrying it, but I mean, we're talking infertility, loss of your womb. There are so many complications, and we have a group of doctors that just aren't willing or not able to address them.
I appreciate both of you coming in and reminding us about the stakes of this. We appreciate the time that you've taken. Caitlin Cash is a reproductive rights advocate. Robin Marty is the executive director of the West Alabama Women's Center. We'll be right back.